Did you know that just one quick glance at your nails, your skin, or the way you take care of your body can help doctors detect serious health problems developing inside you? And the scariest part is, many older adults have no idea they're making critical hygiene mistakes every single day. These small, seemingly harmless habits may actually be the earliest signs of heart disease, diabetes, cognitive decline, or even cancer. And if these signs go unnoticed, the consequences can be difficult to reverse. In today's video, we'll walk you through 7 personal hygiene mistakes that doctors notice immediately in their senior patients. More importantly, we'll also show you simple and effective ways to correct them. These changes can help you protect your health, preserve your independence, and maintain your dignity through the years. Where are you watching from today? Let us know in the comments below by sharing your city or country. We read and truly appreciate every single message. And if you care about staying strong, independent, and informed after 60, don't forget to hit subscribe and turn on the notification bell so you never miss an important video like this. Now, let's begin with the very first mistake. Mistake number 1, neglecting oral hygiene. When was the last time you took a real look at your toothbrush? Are the bristles frayed and worn out? Do you brush twice a day for a full 2 minutes each time? And here's the more important question. Did you know that poor oral hygiene isn't just about bad breath or missing teeth? It's directly linked to heart disease, stroke, and even dementia. Geriatric specialists have confirmed that bacteria from inflamed gums can enter the bloodstream and trigger dangerous inflammation in the heart. Seniors with poor dental care are up to 3 times more likely to develop heart conditions than those who keep their mouths clean. Let me tell you about Mr. Walter, a 70-year-old from Colorado. He was full of life, enjoyed bowling with friends, and never missed his grandchildren's birthday parties. He thought he was doing just fine. But during a routine checkup, his doctor noticed his gums were inflamed. Tests showed the bacteria had already begun affecting his heart valves. "I just thought my gums were bleeding because of my age," Walter said. "I had no idea something so small could threaten my life." Luckily, he received treatment in time. But if he had waited just a few more months, the damage might have been irreversible. So what can you do today? Start with your toothbrush. If it's more than 3 months old or looks worn out, replace it now. If possible, switch to an electric toothbrush. Studies show it removes 62% more plaque than a manual one. Brush twice a day, 2 full minutes each time. Set a timer if you need to. And never skip flossing at night. Even if you wear dentures, your gums and tissues still need care. Have you noticed bleeding when brushing? Redness or swelling in your gums? These are not normal signs of aging. They are warning signs. If you're still watching, comment 1 if you've neglected your oral care before. Or 0 if you've been staying on top of it. Be honest with yourself. Sometimes, something as simple as brushing thoroughly can help protect your heart in the long run. Now let's move on to the second mistake. A common winter habit that often hides early signs of serious illness. Mistake number 2, infrequent bathing and skin care. How often do you take a bath or shower? Be honest with yourself. Many older adults cut back on bathing as they age. But here's something you may not know. Your skin is your body's largest organ. And changes in your skin can be the first signs of internal health problems. Dermatologists warn that dry skin, discoloration, and irritation may appear before other symptoms of diabetes, liver issues, or heart disease show up. Let me share the story of Ms. Linda, 74, from Minnesota. During the winter, she only bathed once a week. "I wasn't sweating much and my skin felt dry. I thought it was enough," she said. But during a routine physical, her doctor noticed unusual discoloration on her arm. After further testing, she was diagnosed with early-stage kidney disease. It wasn't poor hygiene that caused the problem, but by bathing so infrequently, she had missed a visible symptom that could have been caught weeks earlier. So what should you do? You don't need to shower every single day, but try to bathe at least 3 times a week. Even if you don't feel very active, your skin still needs to be cleaned regularly to remove sweat, dead skin cells, and bacteria. Use a mild, fragrance-free soap that won't dry out your skin. After bathing, apply a moisturizer while your skin is still slightly damp. This helps lock in hydration and protects your skin's natural barrier. And most importantly, check your skin regularly. Look for any dry patches, unusual changes in color, or spots that itch or sting. If a spot won't go away or keeps changing, it could be your body's way of warning you something deeper is going on. If you've been putting off regular baths or showers, comment "bathe" to remind yourself it's time to care for your skin. If you already bathe regularly, type "steady." Your skin isn't just about how you look. It's a window into your overall health. By paying attention and caring for it, you're giving yourself the chance to catch early signs and act before it's too late. Now, let's move on to the third mistake. A detail so small, most people ignore it. But it could be the first clue that something serious is happening inside your body. Mistake number 3, neglecting nail care. Take a moment to really look at your fingernails and toenails. Are they trimmed and clean? Are they smooth, or have they become thick, yellow, or brittle? If so, don't just assume it's because you're getting older. Your nails are actually one of the first places where health issues can show up. Doctors who work with older adults check nails carefully because they know that even small changes can reveal serious problems. Research shows that nail abnormalities may point to over 20 different health conditions. Things like anemia, thyroid disorders, or even heart disease. Let me tell you about Ms. Eleanor, 81, from Ohio. She stopped wearing sandals a long time ago, so she didn't pay much attention to her toenails. They were getting thick and yellow, but I figured that was just normal with age, she said. One day, she started feeling pain in her feet and went to see a podiatrist. The doctor immediately diagnosed a fungal infection. It had been growing unnoticed for so long it had begun to affect her immune system. Further tests showed she had an undiagnosed thyroid condition. Thankfully, she got the treatment she needed. But if she had paid attention to her nails sooner, she could have avoided weeks of discomfort and worry. So here's what you should do. Trim your nails regularly. Cut them straight across with a slight curve to avoid ingrown nails. Keep them clean and dry. Wear breathable shoes and change your socks daily. Don't ignore changes in color, texture, or thickness. If your nails are breaking easily, turning yellow, or growing unusually thick, these may be early warning signs your body is trying to send you. If you've been neglecting your nail care for months, comment "nails" as a gentle reminder to start today. If you've already made it part of your routine, type "clean." Your nails aren't just cosmetic. They're part of your health story. By taking care of them, you're giving your body a chance to speak and a better chance to be heard in time. Now, let's move on to the fourth mistake. It's a sensitive topic many people try to hide. But ignoring it can lead to serious complications that go far beyond hygiene. Mistake number 4, improper incontinence management. This is something many people feel embarrassed to talk about. But the more we hide it, the more dangerous it becomes. More than half of all older adults experience some level of incontinence. That includes occasional leaks, urgency, or nighttime trips to the bathroom. But the real danger is not the condition itself. It's how we try to hide it instead of dealing with it properly. Many people use paper towels, change clothes more often, and avoid going out. They think they're managing the problem, but improper management can lead to painful skin infections, increased risk of falls, and even delay the diagnosis of serious conditions like prostate or bladder cancer. Let me share the story of Mr. Richard, 73, from Nevada. He started noticing occasional leakage when coughing or laughing. Ashamed to mention it, he used tissue pads and carried extra clothes. Over time, the skin around his groin area became irritated and painful. When he finally went to the doctor, he was diagnosed with an enlarged prostate, a treatable condition if caught early. "My pride almost cost me my health," he admitted. "I wish I had spoken up sooner." Here's the truth. Incontinence is not a normal part of aging. It's a sign that something inside needs attention. If you're experiencing any symptoms, here's what you can do. First, don't be afraid to speak with your doctor. They hear about this issue every single day. You are not alone. Use proper incontinence products, not tissues, not regular underwear. Keep the area clean and dry. Change immediately after any leak. Track your symptoms. Are they getting worse? Happening more often? Most importantly, never assume this is just part of getting older. Your health matters. And this could be your body asking for help. If you've been silently dealing with incontinence, type "private" in the comments to show you're not alone. And if you've found the courage to seek help, comment "brave" as a sign of strength. When handled properly, incontinence doesn't have to take away your confidence, your social life, or your peace of mind. It's just a small obstacle, and you have the power to overcome it. Coming up next is the fifth mistake. It's something many people do every day without thinking, yet it silently steals away your hearing. Mistake number 5, improper ear cleaning. Most people think cleaning their ears is simple. Grab a cotton swab, twist a little, and you're done. But this is one of the most common and dangerous hygiene mistakes older adults make every single day. Do you insert cotton swabs deep into your ear? Do your ears feel itchy, blocked, or like your hearing has gotten worse? If so, you might be unknowingly causing damage to your ear canal, pushing wax deeper, or creating space for infection to grow. Ear specialists warn that nearly 40% of ear injuries in adults over 65 are caused by improper cleaning. Some of these cases even result in serious infections or permanent hearing loss. Let me tell you about Ms. Margaret, 71, from Oregon. She had been using cotton swabs daily, pushing them deep inside her ears. One day, she felt a sharp pain, followed by ringing and pressure. At the clinic, doctors discovered she had perforated her eardrum. The infection had already spread to surrounding tissue. Despite emergency care, she lost part of her hearing permanently. "I thought I was keeping my ears clean," she said. "No one ever told me this was dangerous." So how should you clean your ears safely? Here's a simple rule. Never put anything smaller than your elbow inside your ear. Instead, gently wipe the outer ear with a warm, damp cloth. If you feel like you have too much wax, use eardrops specifically designed to soften it. Follow the instructions carefully. And if you experience pain, discharge, or changes in hearing, don't try to fix it yourself. See a doctor right away. Your ears don't need deep cleaning every day. They're self-cleaning by nature. Earwax isn't dirty. It's actually a protective shield that keeps out dust and bacteria. If you've ever used cotton swabs deep in your ears, comment "stop" as a promise to yourself. If you've already switched to safe cleaning methods, write "safe." Your hearing is precious. With just a small change in habit, you can protect it and continue to enjoy conversations, music, and the sounds that make life beautiful. Now let's move to the sixth mistake. It involves a part of the body most people overlook. But it may be the first place where serious health issues quietly begin to show. Mistake number 6, poor foot hygiene. When was the last time you really looked at your feet? Not just a quick glance, but a full check from your toes to your heels, from the soles to the skin between your toes. You may not realize it, but your feet can reveal early signs of diabetes, nerve damage, and circulation problems. Doctors who specialize in senior foot care say that your feet are often the first to show warning signs, long before you feel sick. And the most shocking fact? Proper foot care alone could prevent up to 85% of diabetes-related amputations in older adults. Let me share the story of Mr. Thomas, 76, from Missouri. He had dry heels and small cracks, but thought nothing of it. "My feet always looked rough," he said. He rarely paid attention because he mostly wore slippers and stayed indoors. But during a routine check, his doctor noticed changes in the skin under his feet. The color was different. The sensation was dull. Tests revealed he had early-stage diabetes. Because they caught it early, he could make changes right away. "If my doctor hadn't checked my feet, I would have gone months or years without knowing," he said. So what should you do? Wash your feet every day with warm water. Dry them thoroughly, especially between the toes. Moisturize dry areas, but avoid applying lotion between the toes. Check your feet once a week for any cuts, color changes, swelling, or spots that won't heal. Wear clean, dry socks made from natural or moisture-wicking fabrics. Choose shoes that fit well and support your feet. And if you ever feel numbness, tingling, sharp pain, or see wounds that don't heal, see a doctor immediately. These are not cosmetic issues. They are medical warnings. If you've been neglecting foot care, comment "feet" as a sign to start paying attention. If you're already making it a habit, type "daily." Your feet are not just for walking. They're your foundation. Taking care of them is one of the best ways to keep your independence, your mobility, and your confidence as you age. Coming up next is the 7th and final mistake. It's something that can sneak up on anyone who takes medications regularly. And it might be changing your hygiene without you realizing it. Mistake number 7, medication-related hygiene issues. Are you taking several medications every day? Have you noticed changes in your body odor, your sweating, or your mouth feeling dry since starting them? If so, you might be experiencing side effects that first appear as hygiene changes before more serious symptoms show up. Pharmacists and geriatric specialists report that nearly 40% of adverse drug reactions in older adults start with things like excessive sweating, dry mouth, or strange body odors. These changes are often misunderstood or ignored. Let me tell you about Ms. Helen, 67, from Florida. After starting a new blood pressure medication, her family noticed she smelled different, even though she showered daily. They assumed she wasn't keeping herself clean. But her doctor recognized the smell as a sign of liver stress caused by the medication. Had they waited longer, the damage could have become dangerous. "I didn't know the smell was from inside," Helen said. "I thought maybe I just wasn't washing well enough." She was doing everything right, but her body was sending a message through her hygiene. If you're on new medications, here's what you can do. Pay close attention to any hygiene changes in the first few weeks. Keep a simple log of symptoms like odor, sweating, dry mouth, or changes in your skin. Stay well hydrated unless your doctor says otherwise. Never adjust your dosage on your own. Always talk to your doctor if something doesn't feel right. These changes might seem small, but they could be your first warning. If you've ever had a hygiene issue caused by medication, comment "meds." If you've never tracked these changes before, write "aware" to remind yourself to pay attention going forward. Your medications are meant to help you, not harm you. And the sooner you notice a problem, the sooner your doctor can help fix it safely. Now, let's wrap up everything we've learned today. Because hygiene isn't just about looking clean. It's about listening to your body and protecting what matters most. Conclusion: you've just learned about 7 hygiene mistakes that doctors notice right away in older adults. And more importantly, you've learned what each one might be telling you about your health. From brushing your teeth, to washing your skin, to trimming your nails, to paying attention to how your medications affect your body, each small habit is a chance to protect your health, your dignity, and your independence. These aren't just routine tasks. They are early warning signs. And they are also powerful tools you can use to stay strong, steady, and in control of your life. Even a tiny change, like replacing your toothbrush, taking 1 extra shower per week, or speaking up about bladder issues, can make a world of difference in your well-being. If any of these mistakes felt familiar to you, comment "Now I know" as a quiet promise to take better care of yourself. Thank you so much for spending this time with us. If you found this video helpful, please hit subscribe and turn on notifications so you never miss a chance to stay informed, prepared, and empowered as you age. And please share this video with someone you care about who's over 60. Sometimes the smallest reminder can make the biggest difference in someone's life. It's never too late to care for yourself. And every strong step begins with one simple action.